Okay. Veda Peters from the Lung Association, the 11th Annual Air Quality and Health Workshop. I'm here speaking with Dr. Biggeri from Italy, whose presentation was titled, oh, why can't I find you? Here we go, Oil Refineries, Air Pollution and Health. So, with your expertise in oil refineries, what are the health effects and concerns that have been associated with extraction, processing, transportation of same?
Yeah, the question is very big one. We know that in fossil fuel extraction, in processing, usage, there are different exposures and different ways of exposures, and mostly can affect on a short range from the putative source or on a long range or even globally, like the effect on climate change. Moreover, the industrial processes are continuously evolving, so some of these exposures are only partially known. So given this difficulty, this situation about the kind of exposure, the epidemiology can tell something more strictly and something less strictly. What is most known, and almost all of the scientific community is certain about, is the existence of a short-term effect and long-term health effect of air pollutants, and most notably particles and fine particles. Most of the research now is focused on PM 2.5 particles. And this can affect on a short term, which means can give a rise of mortality and morbidity and hospital admission, for example, on a range of 1-2 days from a peak, but also can affect on long term on the development of cardiovascular disease, respiratory disease, and cancer. And these are now well-established results. While for new industrial processes, we have much more difficulties in addressing the health effect. And one of the reasons is that inevitably between the exposure and the disease, there is a latent period in which the pathogenic process is going on. And this cannot be shortened. So we have to wait to discover all the toxicological properties of substances. And unfortunately, we cannot wait to take action to mitigate. So in this sense, as probably we can discuss looking at further questions, a precautionary principle should be taken.
So there are at-risk populations?
Yes, because we cannot wait. And so we are pressured to take actions because by analogy, by anecdotal report, we are fear of potential negative consequences. So we should take an attitude to protect the health of individuals instead of try to act only after definitive proof has been produced by the scientific community, so because it could be very late.
The usual, the very young, the very old, and those with chronic diseases.
Yes, and mention that in public health, the principle is that you don't need to know all the pathogenic mechanisms to take action. For example, for smoking, we set up action to prevent smoke before having completely know the mechanism between smoke and lung cancer. So this is a general principle of prevention. Try to intervene as soon as possible, but in some case, since the biology is preeminent. You have to wait for the whole natural history of the disease to know that. In this period, your uncertainty cannot be eliminated. So you should ask for precautionary principle without having to wait.
So the approaches that exist to minimize health impacts are precautionary.
Yes.
But not certainty.
When we are facing new industrial processes, new substances not yet studied.
And so the knowledge gaps would be to application?
No, the knowledge gap must be filled, but the action cannot be delayed until knowledge gaps will be filled.
And what are the knowledge gaps?
For example, the toxicology of some substances. For example, we don't know the exact nature of some toxicants, and for example, we don't know the amount of exposure of a population because the monitor are not set properly, or we lack information about, or even impossible to put a monitor given that for unconventional natural gas extraction we have thousands of wells and we cannot monitor each of them.
Okay. So I'm hearing that there are risks, but we don't exactly know what they are. And the actions that we're taking right now are precautionary, but everybody needs to be aware of them.
Yes, there are situations in which the system uncertainty is of such extent and the urgency to set up action to protect the people are so pressing that we cannot wait to fill the knowledge gap. So we have to decide in a societal table, not in a technical table.
Okay. Thank you. I think that's answered my questions. Is there anything that you feel the need to add to our podcast?
Oh, just the series of questions from a new idea of surveillance we set up in the proximity of an oil refinery in Europe, the second European super site. We set up a project for environment and health, and we decided to put a population biobank to develop surveillance on new aspects of pollution. And some of the pollution we measured are similar to the unconventional natural gas exploitation with a lot of aromatics and VOC substances. So we don't know what they do. So we set up a biobank to study. But on the same time, we change the political scene because the biobank is a property of a citizen and not of a researcher, and they have the right to decide in which direction and to which purpose to use the stored materials. So this changed the idea of surveillance. And in this slide we put some questions, which is opened by this new way of participatory approach to protection of a citizen. We do protection with the citizen, by the citizen, and we are only companions.
I would imagine that that probably is somewhat more effective than people feeling that they've been dictated to and their concerns have not been addressed.
I don't know if they succeed, but it's different. The people are changing. Today, the people are changing because are much more informed. They can have access to the web, to a lot of information they never had in the past, and they are going to produce information by themselves using sensors. We all set of sensors, even with a smartphone you can measure pollution, and so you can put on the web, and you don't need the researcher, and how can this information be framed in a participatory way, in a positive way?
Sounds good to me.
These are the questions.
Thank you very much.
Thank you.